I was on the phone the other day with a friend who has a lower back problem. And we had actually talked about this particular lower back problem about 3 or 4 years ago. And it's flared up on him and it's become an issue again. And we were in the conversation just trying to decide what to do. One of his questions was, what if I don't do anything? What if I wait? Is that going to be an issue? And I wanted to address that specific question. Spinal problems are common. I think that almost all of us deal with some kind of spine problem throughout our lifetime. And if you haven't had a spine problem, you probably will. Most spine problems do not require surgery. There are a couple of things that can occur where surgical intervention would be strongly recommended and should be done urgently, such as Cauda equina syndrome or a bad spinal fracture. But for the most part, waiting is okay. Most patients really do not have to do surgery. Surgery for spinal conditions is elective, and there's always a thought, should I delay intervention? And I would say that that decision really comes down to what is the current burden of symptoms. How badly does this bother you? And then what are the treatment options? Also, what is the likelihood of improvement with surgical intervention? And finally, what is the risk of surgical intervention? I don't think patients should intervene surgically for a particular problem just because they're going to be older later and might as well do it now because they can recover faster. I also don't think that patients should be concerned about waiting on surgical intervention if that's something that makes most sense for them. Perhaps this is a challenging time in their life when they're not really ready to go through surgery, or it would be better for them to wait 6 months, 12 months down the road, or they're just not sure if surgery is right for them. I think it's totally fair to wait. Now, if symptoms are bad, you may not want to wait. And most of our patients, honestly, want surgery done yesterday. And that's okay too, because we know that spine problems are very painful and surgery can be very helpful. On the other hand, again, waiting is usually okay. The risk of permanent neurologic damage and the risk of putting it off is very, very low. And so that should be taken into consideration when deciding on when surgical intervention should be done.